This white stuff here is fluid around your lung. I need to take some of the fluid off to make your breathing easier.
See one, do one, teach one. That's what they tell you. There isn't the time for proper supervision.
But that's not how it should be. I've heard of junior doctors asking patients to talk through procedures because a patient's had it done before and the junior doctor's only read about it in some textbook. No. If you're not sure, get help. If you can't get help, talk to me. This is on 24 hours a day. All right?
Did you get your wrist slapped?
What I do with my wrist is my business.
Mrs. Trimble!
I don't believe it.
Look, Mrs. Trimble! One hand!
I was hoping to speak to Mr. Docherty.
He's just popped out of the hospital for a few moments. He's, advising on an urgent case at the General.
Mrs. Trimble, look! No hand!
In your 3 theatre lists per week, 2 general, 1 urology, you perform fewer operations than any other of our consultants. And I can't help feeling that it might be a more efficient use of our resources to restrict you to 2 lists per week, freeing a list for another surgeon.
I find medicine abounds with lists. Divisions of the facial nerve, temporal, zygomatic, TZ, 12 Zulus, Boggart, my cat.
Perhaps I'll leave it in your hands, Mr. Docherty.
You want me out, Mrs. Trimble? Adrian de Vries aims to do more vascular surgery. He wants my list. Then it'll be a clinic. Shortly thereafter, early retirement beckons.
Oh, Mr. Docherty, I am sorry.
Don't be, Mrs. Trimble. They haven't got my list yet.
Just chatting to some bloke in the canteen who's going on about how he would have got his operation if this were a trust hospital. I had to confess I didn't know if we were one or not.
Look at if I know. I think we are. No, I don't know.
There's an easy way to tell. If you're not in a trust, the patients wait for ages, the nurses are short-staffed, and the doctors work ridiculous hours for too little pay. But in a trust, the patients wait for ages, the nurses are short-staffed, and the doctors work ridiculous hours for too little pay.
Seems I've dumped on you, Claire.
Yeah. I've accepted 3 patients for you. Only one that's here yet is the query temporal arteritis.
You got the bleep?
Yeah.
3.5 hours you've been going now, you know, Claire.
Continue CPR, please.
I feel obliged to point out that you're occupying the resus room while we're still open to critically ill patients.
Julie, you know that victims of hypothermia are capable of survival after prolonged resuscitation.
Well, let's hope that no one else's chances of survival are jeopardized by not having access to the room. Also, it's taking one of my nurses permanently out of circulation.
All right, then I'll take over.
OK, we could do with an extra pair of hands in the plaster room.
Can you just cover your eye, please? How many fingers do you see?
I didn't realise it was so blurred.
FB right eye, cubicle 7, thank you.
Julie, 200 milligrams of IV hydrocortisone statins.
OK.
OK, Mr. Gillespie, if you'd just like to hop on the bed.
Mr. Docherty, consultant.
Me John Thomas is playing up. You know, Percy.
He means he's one-eyed trouser snake.
Me winkle. Me meat and 2 veg.
His Todger.
What seems to be the problem, my boy?
This fella's catheter's stuck. We can't get the balloon to deflate.
If the catheter is cut above the valve, the balloon will deflate spontaneously. Oh, dear me.
What are you going to do now?
Don't panic, my boy. All we do is wheel you around to ultrasound, wherein we drive a long needle through your abdominal wall and pop the balloon inside you.
Ellie May could not believe that those hands, which had guided a fighter plane so pitilessly through the skies of Vietnam, now were caressing her yielding body so sensuously. Oh, Chuck, she breathed.
It's like an oven in here. Carry on.
It makes me want to chuck.
A building worker's fallen off some scaffolding, multiple injuries. They're bringing him here.
I'd like to continue this resus.
Well, we're going to need a room this size if we're going to be able to do x-rays on a new patient. It also sounds like we'll be wanting an anaesthetist.
We'll move him into one of the cubicles. James, you join me when you're done.
You need a hand for a few minutes.
Thank you.
Don't get through in the corridor. Find out.
Okay, first head.
Okay.
All right, okay.
Go in.
Frank, Mrs. Johnson, room 2, please. We'll transfer them.
No, I'm going to have a word.
Excuse me.
I've had Dr. Shaver on the phone. Do you know who that is, Raj?
No.
Personal friend of mine who happens to be chairperson of the local medical committee. She also happens to be GP of the patient you saw last night and told to go home, who's come back in today with temporal arteritis. What the bloody hell do you think you're playing at, boy?
Dr. Shaver also phoned me, Adrian, in my capacity as consultant in charge of A&E at the time. Raj, my understanding is that you were only given a vague history at a time when you had a number of pressing clinical duties. I suggest that you and I meet in private to discuss the lessons that can be learned from this case.
Yes, Mr. Docherty. Thanks, Mr. Docherty.
Ernest, I sincerely hope that's not him off the hook. Ruth Shaver has warned me.
Dr. Shaver is a profoundly silly woman, Adrian. You might care to remind her that by informing you of this case, because of a close acquaintance, when you have no direct involvement in the patient's care, constitutes a breach of confidence. If I hear of any further discussion, the matter will be referred to the General Medical Council.
Coming through here, please. This way.
My patient.
Here.
Raj, it is mandatory that you take a complete history and perform the appropriate clinical examination if you are to make the diagnosis of temporal arteritis. If untreated, Raj, the result can be permanent blindness.
Yes, Mr. Docherty. I'm sorry.
Yes, I agree, Sir Morris. It probably is nothing to worry about, but perhaps it would be more reassuring for all concerned if I were to see her ladyship at my rooms this evening. My pleasure, Sir Morris.